Hi, Dr. Michael Dimattina, founder and medical director at Dominion Fertility in Arlington, Virginia. So today I thought I would give you some helpful hints on how to best test for ovarian reserve. You know, patients and women just in general want to know about their fertility potential. And you as an OBGYN are clearly capable of doing this. So I want to tell you how I do it, and you can do the same. The best two measures are a serum AMH level, anti-Müllerian hormone, which can be drawn any day of the week or the month. So it's cycle day independent. So you don't have to do it on day 3 as you would if you were doing a serum FSH level, which I don't do anymore. I use the AMH because it's more stable, more reliable. It's an easier hormone to measure. FSH has a lot of minute-to-minute variation and day-to-day variation. And a lot of patients don't even know what day their cycle day. They think it's day 3, but really it's not. So you can't rely upon FSH as well as a serum AMH. The other thing you need to do is a transvaginal ultrasound examination on the ovaries to assess the ovaries for an antral follicle count. So what's an antral follicle? These are follicles that are less than 10 millimeters in the ovaries. Preferably, she has follicles that are less than 6 millimeters in size, because studies have shown that these antral follicles may have a better indication of ovarian reserve. So if you have a patient who has a lot of antral follicles less than 6 millimeters, she has strong ovarian reserve. Does this mean she's pregnant? She has a good chance of getting pregnant? Not necessarily. Remember, 40% of the time it's not her, it's her partner. You know, male factor infertility, quite common. We see it all the time. And comprehensively, of course, we would check the tubes with the HSG and other things. But for ovarian reserve testing, the two best indicators are going to be serum AMH and also a pelvic sonogram for an antral follicle count. Having said that, who should you do it on? Well, as you know, ovarian reserve is age dependent. But I would tell you, any patient who wishes to be tested should be tested. Because we see people, even in their 20s, have poor ovarian reserve. Wouldn't that be amazing if you found that out? Because you could say, hey, listen, you need to be aware of this. So in case you're thinking of perhaps having children someday, maybe you ought to go get your eggs frozen now. If she didn't know that, she walks in her 30s, maybe it's too late. Remember, 1% of reproductive age women, that's 1 out of every 100 women of reproductive age, go through premature ovarian failure, and a large number of those other women have diminished ovarian reserve. So I'm empowering you, I'm telling you, I want you to test these patients for their ovarian reserve. We want to make sure that it's done properly, and the best ways are the serum AMH and the sonogram for the antral follicle count. Thanks so very much, Dr. Michael Dimattina at Dominion Fertility.